We are live at the Honolulu Star-Advertiser with Lieutenant Governor Josh Green to talk about the latest updates on the coronavirus in Hawaii. Thank you for being here.
You bet.
We are going to take some reader questions, but we just wanted to get an update on, now that the coronavirus crisis has been deemed a global pandemic
Yes.
by the World Health Organization, what does Hawaii need to be doing right now to prepare for a likely outbreak?
We need to be doing what we have been doing, but more of it. We need to be preparing for the eventuality that we're going to have more cases. We have 2 cases confirmed right now. There are some patients under suspicion, and we're waiting for their lab tests. We have another 60 or so people in home quarantine, home monitoring, making sure that for the 14 days they don't get out there and spread any possible infection if they turn positive. What we're doing really is making sure that at least my team and I go statewide, go to all the hospitals, make sure they have what's necessary in case, God forbid, we have cases. So plenty of equipment, plenty of capacity in the ER, plenty of capacity in intensive care units that we can take care of people if they get sick. That's one big piece of it. We also now have to coordinate with other governments and entities and agencies because it's a pandemic. So we already were doing some of that, now it will be global and seamless. So national lines mean less when it's a pandemic. Also, we have to test more in Hawaii. There was a pretty severe restriction on testing until a week ago Monday, which is now 9 days ago. That's when the CDC finally let us start testing with our own state labs, people that were not just from those geographic regions. That was too restrictive, obviously, and we were all frustrated as healthcare providers, me as a doc too, that we couldn't get adequate testing. We had good news yesterday. 2 of our labs are now capable of testing. That's clinical labs and DLS. Those 2 labs can send the test, get the results in about 3 days. Really big change, and we'll talk more about testing, but getting the actual idea of how many people are positive possibly is very valuable, and we'll keep doing the public health stuff that DOH does very well, which is surveying. They're announcing expanded surveys of the community and hopefully more tests of people in the ICU.
Do you think the lack of widespread testing to date has been due to, say, a balance between the economy and public health?
I think it was actually more an abundance of caution that they didn't use too many of their tests. I think that everyone knows that each and every region of the world now is potentially exposed to COVID-19, and so I don't think that anyone pulled their punches because they thought being too honest about the number of cases was going to do damage. I think actually they were worried more that they would exhaust their staff, they wouldn't have capacity to do all the testing, and that the testing could overrun the system. But did I prefer they do more tests? Of course. I think we should max out and use all of our tests, as I've said quite a few times. We can do up to 250 a week with a bonus of another up to 500 if we really double down, and we should do that. That's Department of Health testing, and they're now going to do that community surveillance, and that should help too. It almost becomes a moot point now because any physician out there or nurse practitioner or PA can order the COVID-19 test. They do the swab, which is a nasopharyngeal swab deep into the nose. They get the test result sometime that same, in this case 3 days, but soon it will be same day. That is a big improvement, and then we'll report all of this data to the Department of Health to also let them make plans for us as to which groups are at highest risk and so on.
So they don't need to go through the Department of Health any longer?
No. The private tests are purely the prerogative of physicians. I still think physicians should test the right people. People should have the symptoms. The symptoms of COVID-19 are, in this order, high fever. So 88% of people have had fever, then it's cough, and then shortness of breath. So when people have those symptoms, you should then test somebody for the flu. You test people for flu A and B. If the flu tests are negative and people have these symptoms, I think it warrants a test for COVID-19. And also people should stay home quarantined until it gets resolved.
Can you tell us again how much deadlier the coronavirus is versus the flu?
Absolutely. So let's do some big picture stuff here. The flu affects about 8 to 10% of the global population. So that's like globally, every year, about 500 million people. It's a huge number, right? Get the flu. In America, 10% of our population is, 30, 40 million people get the flu every year. And the flu kills about 1 out of every 1,000 people, for a rough estimate, okay? So it's very lethal, and that's why tens of thousands of people die of the flu every year. Now, look at COVID-19. COVID-19 is more lethal than the flu. COVID-19 is only affecting a small percentage of the world right now. We're at about 116,000 cases or so of COVID-19. We're at just over 1,000 cases in the United States, and we're at 2 cases in Hawaii. However, COVID-19 is got a mortality rate of as much as 3% across all the population. That would be 30 out of 1,000 instead of 1 out of 1,000. Also, COVID-19 is killing 8% of individuals between age 75 and 79, and 14% of individuals that are 80 and older. So in that case, let me break this down for you. If you've got a teenager with the flu, the odds are very unlikely it's going to kill them, 1 in 5,000. If you have a senior, like say an 85-year-old with COVID-19, the chance is 14%, or 140 out of 1,000. So very different numbers, and so COVID-19 is more worrisome. Over time, the death rate will probably look lower because we'll see that there were many more cases we hadn't detected, and therefore the death rate will be lower. But it's too early to know some of these things. That's why we're really all trying globally to slow it down, protect until we're ready.
So if seniors are at the highest risk, should they be self-quarantining already?
Wow, very good question. I would say seniors, if they are concerned, if they don't have very good health, should avoid large crowds. There's already in real time people starting to talk about crowds being limited. California, they just announced that there will not be any crowds over 1,000 people allowed. Some colleges across the country are looking at smaller numbers, just 25 people together at a time. I would say this: if you were thinking about going to, say, Merry Monarch or the Kona Brewfest this weekend, or a big event here on Oahu, if you have chronic disease or you're elderly, probably don't go. If you are a healthy young person doing fine, don't worry about it. If you're in middle age and you're healthy, don't worry about it. That's the way to approach it right now. We have not seen any community spread in Hawaii. We've so far only seen 2 cases, one that came from a person that was on a cruise ship, and the other person was from Washington State. So we have not had community spread, but the way to keep community spread from occurring is to not cluster in large groups, and that's why you're starting to hear more of that. We will see once we've done a lot of testing for about 10 days whether there's been an underlying number of cases of COVID-19 that we didn't know about.
Well, it was reported today that a Canadian doctor who was on a personal trip to Hawaii was recently diagnosed with the coronavirus. How likely is it that we already have undetected cases or community spread in the islands?
That's pretty darn likely. Now, I couldn't put a number on it, but the problem is we can't confirm it. We've had enough travelers here that ultimately were in contact with people that were COVID-19 positive. It's just likely that there's been some spread. It's probably low symptoms, not super infectious people, but most of the doctors I'm talking to them constantly across the state, believe that there's an underlying disease burden or number of people that have the COVID-19 disease. How many? We're going to get an idea when we do the surveying from the Department of Health and our general medical population starts testing more people.
So what do we know so far about the 2 people who are confirmed cases with coronavirus and those who are quarantined?
Well, the people that are quarantined so far have been asymptomatic, doing very well. There might be a couple people that are increasingly worried because they're getting cold symptoms. We'd like to test them, and we're going to make some recommendations to have them get tested. I think that the key is we don't want people out there spreading it. So if people are not very sick, honestly, it's not that big a deal. 80% of all people just have very, very mild symptoms. If you have mild symptoms, certainly do not go into the ER or your doctor's office because you'll end up taking the risk of spreading it. One of the individuals that was tested positive is very sick and has required emergency and intensive care unit support. That individual, I believe, traveled from Washington State. So it's very risky in that circumstance. The reason that I've been pressing hard for tests at facilities and everywhere else is because most people will just be the flu, honestly. Like I said, we're going to have over 80,000 cases of flu in Hawaii, very likely this year and every year. But a lot of doctors and hospitals need to know because they're going through all of their personal protective equipment. They have to go and live their lives as well and know whether or not they have been exposed, whether they should get tested, whether they should be at work. All these questions are super relevant, and that's one of the reasons to do the testing. Now that we have the backup of the private sector testing, there's no reason not to use all of the weekly allotment of the state's supply.
So we have a reader question from Twitter. Why is there so many conflicting medical advice being given to medical professionals around the world, as in what to do and how to treat?
Well, that speaks directly to the fact that it's a novel coronavirus. It's very new, and each of these coronaviruses is a little different, just like each flu is a little bit different. I can tell you what the best advice I have is, which is, if you are sick, don't go to work. If you are sick, don't go to school. If you have a fever and shortness of breath and coughing and you test negative for the flu, somebody needs to test you for COVID-19 now. That way you'll know whether you're in the higher risk group. And the people at most risk are people who are senior. I'm going to say over 70, though the risks increase with age. So if someone's 87, they're getting towards the highest edge of the risk factor pool. If they also have chronic disease, very risky. So the reasons that you hear different advice is because a lot of this is emerging as far as science goes. We've begun to treat some people with medications from one of the pharmacy companies, and we'll see if that bears any fruit. They've tried to use antivirals on people. I don't think right now that there's any clear consensus that that works at all. Really, it's mostly supportive care, which means breathing help and fluids to keep people from getting tragically dehydrated and dying. That's the way to go, and that's the way you deal with what's called ARDS, which is acute respiratory distress syndrome.
So officials have said to stay home when you're sick. Is there any enforcement for breaking that rule? Going to work when you're sick, going to school when you're sick? Is there anything we can do here?
There's no enforcement. It's kind of a moral obligation to do that. However, if you come from a highly at-risk region and the director of health feels that you need to be quarantined, in this case Dr. Anderson, he has the capacity to quarantine people in a mandatory fashion. That's what we did with the individual that traveled from Hubei province. Though he was not sick, he was at very high risk. If someone does test positive and they're at home, they're doing basically recovering at home, and they're doing home quarantine, they cannot go out. They need to be in for 14 days. If someone finds that they're out, then we can make sure that there's some force applied to keep them at bay, at home. There's also discussions, of course, of having quarantine centers. And quarantine centers would be particularly valuable if people didn't have a home here. If you have mild symptoms, you can do it at home. You got to stay away from people. That's the deal. If, however, you were traveling, say, from France and you test positive, or Italy, or wherever, and you don't have anywhere to stay, we don't want to put people in hotels. We want to put them in quarantine centers. So Director of Health is working with Department of Defense and those folks to find spaces where we can have 5 to 10 people, low impact numbers, make sure that they are forced to stay into quarantine, and that would also apply to the homeless population. We have a lot of homeless in our state, and God forbid they get infections, and then we're going to have to place them. I will say this, we're very keen on using some of the respite beds, say at a facility that doesn't see anybody else. Take the H4, which just finished its 3rd and 4th floor. I know we're working with the county. We've made a request to make sure that that's available so that those beds, 21 beds on the 3rd, 21 beds on the 4th floor, perfect, available. They're 240 square feet. People could be sent there if they're sick. We obviously want them to be treating the homeless, and that's what the plan's been all along. So we'd like the mayor to kind of authorize that. There's been some kind of minor contentious argument between the builder and city or something like that, but this is not a time for those kind of arguments. This is a time where we have emergency proclamation out. We don't want spread.
Do you have any updates on the facilities? We had mentioned Leahi Hospital could be a facility where people who test positive could be quarantined, as well as Wahiawa General. Are there any other facilities that could be possible quarantine centers?
I wish I could say I do. I've deferred to the DOD on this, Department of Defense, and our emergency management folks. So they're going to pick those places. I hope that we have them set up before, and I'm putting that in the hands of the Department of Health. They've asked to take care of that.
Okay. Do you think we should be screening all visitors entering the state, or at least visitors from the areas of outbreak?
I think we have the capacity to do that now. If we start seeing any community spread, which I suspect is going on, if people have the least symptom, yeah. If anyone comes in symptomatic in any way, I would recommend that we screen them. It's difficult because if you are too aggressive, people go kind of underground and they won't convey that they should be screened. I think that we should be taking people's temperatures the best we possibly can when they come into the state. It's very hit or miss though. It's not fully effective. Anyone who's symptomatic, that's one of the reasons we want to set up these regional testing centers, because they will not have a doctor here, and we don't want them to go to the ER and potentially spread their COVID-19. So having regional testing centers with that capacity is one of the things that the Maui medical community reinforced with me very clearly yesterday. They get a ton of visitors at their hotels, and if they have these symptoms, they want them tested.
We have another reader question. Can cooked food be contaminated with the coronavirus?
My expectation is no, and I haven't heard of any cases. We did interestingly just have an outbreak, a small outbreak of listeria, which is a bacteria that goes on vegetables, and it was on the enoki mushrooms, those little mushrooms, and it did kill one person. So listeria is a very serious bacterial infection, not virus. It affects pregnant women disproportionately and older people disproportionately. It can be treated though, but the COVID-19, no, not on cooked vegetables.
What do you think about, an asymptomatic person, someone with no symptoms, can they still spread the virus?
It's a lot less likely is all I can really say. We don't know the exact details about whether you could be infectious a half day before or a day before. I will say this about viruses in general. If you are not having your fever, coughing, sneezing, runny eyes, runny nose, you're just very minimally infectious. When you have those symptoms, you're very infectious. So we've tended to track fever as a correlating symptom with infectivity, but there could be a day before and after, I would say, of symptoms that you still are infectious.
And how long does the coronavirus survive on surfaces? How long can it stay airborne when somebody coughs or sneezes?
Great question. So on surfaces, for the most part, it's minutes to hours. There's certain surfaces that are made to allow for bacteria and viruses to survive because they're doing research on it, certain kind of plastics and certain steels. In that case, they said up to 3 days it was possible. But on this table, for instance, right here, it's probably just minutes to a couple hours, and frankly, if we just wipe it down, it's totally gone.
What about clothing?
Clothing, again, briefly, minutes to hours. I can't confirm that 1,000%, but I can say that that's what the expectation is and what they've shown so far.
And what disinfectants should people use to kill the virus?
I'm not an expert on that. Some people say put some bleach in water and it helps. Definitely hand sanitizer helps our hands. Putting regular soap and detergent on surfaces and wiping them down has been good. I keep a couple of the hand wash things in my bag. Pretty much your rank and file cleaning products are good enough to kill this virus, which is not strong enough to really survive forever on the table.
So a reader is also asking, can the virus spread through pipes from one apartment to another, through water, the water pipes? Or
We don't think so. They've looked hard to see whether any of the virus is in feces, in the oral fecal route. That's the way we say it. It's like hepatitis. So we don't think so. Hepatitis A, that is. I don't think so at all. I think it gets immobilized pretty quickly. And people should not be afraid of the water products that we have.
So after Governor Ige urged everyone to prepare a 14-day emergency kit,
Yes.
Folks rushed to buy toilet paper, hand sanitizers, and whatnot. Are they going overboard? Should they be cleaning off the shelves like that?
No. People shouldn't do that. Don't overbuy. It's good to have that supply of medications if you're a senior. I would even go so far as to say having a month of medications is very good if you're a senior, because you might not want to go out. I mean, you might want to lay low because you're at higher risk. But otherwise, people should not be hoarding Simon, peanut butter, toilet paper. No way. Of course, we're just a few months away from the hurricane season, and that will be available then, so everyone will be comfortable with their toilet paper, but it's really not necessary.
The messaging has mostly been about hand washing, of course, staying home when you're sick and covering your cough and sneezes. Is there a proper way to wash your hands?
There is. Let me show you, and then I'll maybe do a demonstration later. You want to wash. Put a lot of soap on your hands, okay? And you want to wash, like this, and you want to get between your fingers like this. The amount of time is it's about 20 seconds at least, but you want to be able to sing happy birthday to yourself in your brain twice. Then you go on your fingernails like this, where there's a lot of soap, to get that bacteria or virus out of there. And so after you've sung happy birthday to yourself twice, you're done. And then rinse it off and dry your hands.
Okay, if people are healthy, should they wear a face mask to protect themselves?
No, because the face masks, the surgical masks, don't protect you because they don't stop droplets and other things from getting through and particles from getting through. They help you because they keep it a little bit contained if you're sneezing and coughing, if you're super sick. And also it keeps you from touching your nose, which is good. It's a very good prevention method if you're quite sick for the basics. The N95 masks, the N99 masks, they really knock a lot of stuff out. They block it, but those are mainly reserved for healthcare facilities and people deep in the infection.
I saw Costco had some N95s just the other day, but it was wiped out. I mean, regular citizens are wearing N95s out. Is that?
It's not the recommendation. It might protect you a little bit more, but honestly, that's probably going to cause just as many times where people get hit by cars because they can't see as well, they can't pay attention as well, they might not be fitted properly. If they're not healthcare providers, I wouldn't do it. And the healthcare providers are supposed to do it really to protect from spread back and forth between them and their patients, back to them and the cancer patients that person who contracted the COVID-19 and returned to Canada had. That's the kind of reason to have those masks for them.
So if people have upcoming travel plans, should they cancel them at this point?
It depends. You should follow the CDC guidelines, which are travel advisories levels 1, 2, and 3. I will tell you what my family's doing. I have work to do in Washington, D.C. over spring break to go see people like the leadership at the CDC and the Department of Health and Human Services. I'm going. My family wants to still go see attractions in the evening when I'm not working. We're going to go. We feel safe. Every one of us, thank goodness, the 3 of my 2 children and my wife are very healthy. They don't have chronic disease. They're not at higher risk, so going makes sense. What we are saying to people is, if you stay, do a staycation. We want to beef up our own economy and do the staycations here because a lot of people have canceled for the short term. They'll come back, believe me. But in the short term, there's very good opportunities. There's cheap rates. You can get inter-island travel. The planes are pretty much thinned out. They're not as full as they usually are. So it's a great opportunity to go and have a staycation on Maui or in Kauai, on Big Island. I mean, really good time.
So you think it's safe to travel still to the mainland and the neighbor islands?
I do, for sure. I think there are certain areas where it's a little bit more risky, like Washington State right now is more risky. Also, of course, people are not going to cannot travel to Italy or China. There is extra concern in Japan, South Korea, but only if it exceeds level 1 is just you pay more attention. Level 2 is you don't go on any non-essential travel if you have sickness or you're senior, you're elderly. Level 3 is no non-essential travel for any group. And then level 4 is they shut it down, stop the state, the nation that you're traveling to. So people should definitely come to Hawaii, and we should definitely send our family and friends to other places in the U.S. But it's a case-by-case consideration.
Okay, we have another reader question. Let's see. So, at what point are we going to pull the trigger on social distancing? Is it when we have an outbreak? Is it when we have a cluster of outbreaks? Or when a reader's asking when is the right time to close schools?
That's when we have community transmission, and we feel it will be more risky to have kids in school than out of school. Right now, sending 100,000 children out of school where the parents can't go to work and they're out running around at the parks and playing, that could be more risky, conceivably. Plus, we have good nursing care at all of our schools or in our school districts, school regions. I would say you're seeing some social distancing occur just because people are canceling events of their own volition, especially if they're very large. We have canceled a couple events that I've been a part of. I haven't canceled any, but they've canceled them. We were going to have a celebration, for instance, of the Samoan mission on Friday, and they decided just not to do it right now. There'll be better times to do that, and we thank them for all of the love that they have given us and thanks that they've given us. So there's some things we don't do. You saw that the folks in California are not going to have any spectators in the stands of the Golden State Warriors. Now, the Golden State Warriors stink this year anyway, so I'm not sure anybody was going. But in general, The Lakers are still trying to get their fans there. So people are deciding which city and state are going to make these decisions. I would say this. Wait on canceling your events until it's more severe. Everyone will understand if you have to, of course, and we're getting guidance as we go. When there is community spread, I'll say it again, if that happens, then there'll be more social distancing recommendations from our Department of Health.
And how long would, say, a state-mandated shutdown last?
That's a very tough question. I would say for large questions, we'd probably do it in 2-week increments so that we could be nimble enough. Some very good news out of China today, for instance. They have only 20 new cases all across the nation. That's after about 3 months. And so I'm hoping and expecting that after 3 months of the concerns that we've been facing here in Hawaii and across the mainland, that we also start seeing a flattening and a dropping off. They've done a good job, finally, after a bad start, they've done a good job in the last couple of weeks of settling things down and quarantining people. We've done a good job from the start. We are seeing lots and lots of cleaning products out, lots of people avoiding events if they're sick, and everybody has been basically cooperating completely with the quarantines, the home quarantines and the mandatory quarantine for that one guy.
Another reader question is, can COVID-19 be transferred via mosquitoes?
Not to our knowledge. I don't think so. We've not read or seen that at all.
Okay, great. Health officials have said the virus spreads during close personal contact. What does that mean? Is this too close?
Yeah, this is way too close. I'm just kidding. It's close if you're sick, right? So it's within 6 feet if you have symptoms which cause you to expel droplets. So if you're coughing and sniffling or sneezing, then you want to be at least 6 feet away from people, and the person who's sick should wear the surgical mask to prevent spreading of those germs, or at least cover up very much like this. It takes a lot more to cover my nose than many people, 'cause I got a big nose, but I would cover it up completely and don't cough or sneeze on people. That's where, if you're sick, 6 feet apart. And also, you want to not be in contact with people for long extended periods of time like this if you're sick, because it's a highly probable infection. If we spend a half hour like this and one of us was very sick, it's very likely we'll spread.
So if people can't find masks,
Mm-hmm.
when they need them when they're sick because they're completely sold out, what do they do?
Well, if they're a healthcare professional, they should call the Healthcare Association or me, and we can do what we can, especially if they're hospitals or long-term care facilities. That's the role of the Healthcare Association, to get them their supplies. If they're private physicians, this is a different story. Then what they should do is they should encourage people who just have cold symptoms to do telehealth, communications and do FaceTime, legitimized telehealth, or phone calls to just check on people. That's one of the reasons we're having the conversation about having centers. The regional testing centers, Safe Japs and Queens is going to put one up, and I think even Dr. Miskovich over at Windward Urgent Care is planning one for this weekend. He's over there and he's going to do it from 8 in the morning to about 2 in the afternoon. If a doctor orders it, you can get that test. But if you don't have the PPE in your private office, then you want to definitely do as few of those checks on people with the runny nose, fever, cough, shortness of breath as you can. Also, one idea is to segregate your day so that the morning is for your chronically ill patients, all the people that you see normally for whatever their chronic health problems are, and just use the afternoon for infectious disease. So that way, you see people who might be sick, you have all your people wearing their protective gear, and then in the evening, you of course have your whole office washed down like is common. And then you're in a good spot.
So another reader question, New York is producing its own hand sanitizer due to shortages. Would you recommend people making their own, since hand sanitizers are all sold out? I've also seen videos of people making their own masks. You
definitely can make your own hand sanitizer. Usually you're just talking about a concoction of soap and cream. And I think on the internet they've got some recommendations. You can even make it green for St. Patrick's Day if you want. But do it, no problem, if you can't get other hand sanitizer. But soap and water is still very, very good. As to masks, any mask, you should think twice before using a makeshift mask, because a mask has to, if it's going to be helpful at all, especially if you are having a cold or whatever, it's got to cover both your mouth and your nose, totally. If it doesn't do those things, it's useless. And there's also spaces on the sides if you just make a makeshift mask, and so when you cough or sneeze, it goes out the side. So there's lots of problems with that, but again, I understand. I would say people, if they're feeling that significantly concerned, do some social distancing and stay home and have people bring you pizza and just, lay low, because masks are not going to be the answer overall.
And neither will glasses, I guess.
No.
Wearing glasses.
Not going to help. Yes.
Okay.
So not going to help enough. I mean, it helps some. If you're doing the tests, let me say this to the physician community. If you decide to do the tests, the nasopharyngeal swab, you need to be in PPE. You need to have a proper mask, probably an N95 mask. You need to have eye covers, and you need to have gloves on and a light gown, because when we do the test, people sneeze and cough and sputter, and it will expel that onto you, and then you're going to get sick, and then you're no good to your patients. So definitely wear PPE, personal protective equipment, if you're doing the tests. And that's what we recommend to anybody who's starting these regional testing centers.
So the next reader question is on capacity. Do we have the capacity to treat, in the case of a large outbreak in Hawaii, do we have enough personal protective equipment, masks, ventilators, and ICU beds?
The answer right now is yes. Right now we do. With an almost non-existent outbreak and no community spread, we're fine. We are seeing a big surge in testing for flu, and we've had plenty of flu this year. That's always a challenge. On Maui, like I said, they're testing and swabbing for people with fevers and then flu before they even go into the hospital. We do have enough ICU beds currently. We do have enough quarantine space currently. If we saw a major surge, like a doubling of people's concern and risks, and if we saw a big surge where we had 100, 200 individuals at the same time with COVID-19, our ICUs could be overrun. We could end up with a major problem. So that circumstance would require a legitimate ask to the emergency management folks, and we would then have to look at whether or not we're going to activate them and mobile hospitals and so on. We've never really had to do that, so it seems very unlikely to me, but it's a brave new world and it's a new virus.
Another question people have is, should we restrict cruise ships and flights from areas of outbreak? At this point, what are we doing about cruise ships?
Well, flights are being restricted only based on these travel advisories 1, 2, and 3. I think we should be cognizant of the fact that if people are traveling from those areas that are higher risk, we might as well at least do the testing for fevers, and probably it would be a decent idea to even get a COVID-19 test. It's not that expensive. It's a nice safety thing. Boy, the question about cruise ships, I think that they, as an industry, have to make up their own mind. We definitely are seeing more testing for them, which is good. They're seeing more cleaning from them, which is good. We're seeing the federal government make more demands on them to be safe, which is also very good. But I took the strong position a couple days ago that we should pause on cruise ships for 60 days until they themselves know better how much infection they might be spreading and how much risk they face. There's also places that are much better equipped with a lot more facilities than Hawaii to deal with cruise ships. So that's another consideration. I think the cruise ships are going to come to that conclusion with the federal government in the not so distant future that they do have to hit the pause button.
We are running out of time, but how can people who think they might have the virus get tested? Who should they call?
Well, they can call a couple different groups. If people are feeling short of breath and they have fever, they need to go to the hospital. They should call the hospital, tell them they're coming in. All the hospitals can then make a determination. So if they have that, like I said, fever and shortness of breath, they're going to need to be seen. They'll get x-rays, they'll get tests, and the Department of Health will not even have to approve a test now that we have the private sector labs up. If people are just having the upper respiratory symptoms, maybe a low-grade fever, little cough, they're just not feeling great, they will be able to go as we begin to put up regional testing centers and check people for the flu and then COVID-19. Very, very valuable. And that's going to be, I understand, Queens is going to begin doing something. I've reached out to JABSM to consider doing a regional testing center. I know they're going to begin to do that on Maui, and there's certainly capacity to do it, I think, with the private sector. And Windward Urgent Care, Dr. Miskovich and Kaneohe, is planning on giving this a try on Saturday. Saturday from 6 in the morning till 2 in the afternoon. Then they could do it safely, because there's two differences. If I'm in the clinic and I'm just a doc that doesn't have the stuff, the protective gear, I should not be doing that test and having people risk infecting me. If, however, I'm in the emergency department and I've got the protective gear and someone's got these symptoms, absolutely. Run the test, the private sector can get back in 3 days. We can give them treatment until then, fluids and oxygen, and they'll be fine.
So, last reader question. Are hotels safe with all the international travelers, the tourists?
I believe they are. I think hotels are safe because of many things. One, when travelers have gotten sick, they've demonstrated very good self-discipline and stayed in their rooms. Also, when people have conveyed that they were feeling sick, the housekeeping staff has been told and alerted immediately. They do a great job cleaning up the rooms. And I think hotels are safe in general because we have a very low disease burden right now, just 2 patients, so there's almost no risk in Hawaii. So hotels should feel fine. I think that it's a big question going forward, how long you worry about things, but soon we're going to have even faster tests, and we'll know if anybody's positive right off the bat.
And finally, can you speak to the economic impact that we might see, depending how long this crisis goes?
Yes, it's going to be substantial. For one, China is going to have a major recession, I believe, because they're losing all their travelers from everywhere. Japan's going to have a recession because they're losing all their travelers from China. It's about 40% of their economy. So when those two places go down, we don't get the 1.5% of our economy that's from China. If we don't get as many travelers from Japan because they're down and out economically, we lose that too. We're expecting to see a 10% decline in tourism at least for the revenues over the year. We will see exactly what it is, whether it's a little less or a little more. And that's going to translate into very significant challenges economically for the coming year. But we do have some special funds, rainy day funds, for this purpose exactly. I know that the leadership, I was with all of the excellent reps from Maui, senators and reps, and also the mayor. They're preparing for this, and they're preparing to put emergency funds into the treatment and management of the disease. And also, there's going to be resources for people to get on their feet real quickly so that people don't have to pay for lost wages. If they have to be quarantined for 14 days, they don't lose their job. Probably boosting some of the economy with building. We have to build a lot more houses. We should be building 6,000 to 10,000 units a year instead of the 2,000 units a year we build. So we have to fix that. This is a good way to boost our economy. So I think people are going to be fine. I think people are going to get tested when they need to be now. And I think that people in the economy are going to understand that maybe it was a very rough year, but we're going to come back strong next year.
Thank you so much. We appreciate you being here and
bet.
hope you come back.
I will, for sure.